She is a key part of the local fight against COVID-19 here in our community. And in today's KSAT Q&A, we are joined by Dr. Junda Woo, the medical director at Metro Health, to talk about things like at-home tests, when to quarantine, when to isolate, all the things that we're all trying to keep straight as this pandemic continues to change. Dr. Woo, thanks for being here. Let's start with that in terms of knowing when to quarantine, when you should isolate, and what rules at this point apply to who?
Thanks for having me. Isolation is for anybody who tested positive, whether you have symptoms or not. And the big message is it's not just 5 days for everybody and that's it. I think there was a little bit of an uproar when that was what people thought the rule was, but it's always been that applies to people who don't have symptoms or have very mild symptoms that are going away by day 5. If you're still feeling sick on day 5, if you still have fever, the regular quarantine time is at least 10 days plus until you haven't had a fever for 24 hours and your symptoms are improving. Quarantine is now really complicated. It depends on things like your vaccination status, as well as, why you're quarantining. So I actually refer people to some online calculators, like there's one that the state of New Jersey has, just because it's easier than explaining all the details.
It's interesting that you bring it. I think that's an important fact. 5 days is if you're asymptomatic, you don't have any symptoms, or you're feeling better by the 5th day. If you're still feeling sick, stay home. You should still isolate. Do not go back to work. I'm glad you pointed that out. When we talk about home tests, there are a lot of people who are concerned about the accuracy of home tests. But it's my understanding, and correct me if I'm wrong, if you get a positive home test from one of the FDA-approved home tests, you can almost take that to the bank. You are positive.
At this time, if you're positive, then absolutely. I'm not going to go into how positivity, there's something called positive predictive value, how accurate you can count on your test being changes depending on how much disease is circulating in a community. But one really important point about home tests is the ones that come two to a box, those are meant to be used, both of them in sequence. You got to read the label, it's wait at least 24 hours, but before, 36 to 48 hours. But you have to do both to get the accuracy that is being claimed on the label.
I think that's a point that a lot of people are missing, especially now that the tests from the Postal Service, federal government are coming out. It's almost like, well, one for you, one for me, everybody in the household. But those two are meant for the same person, is what you're saying.
Think of it as one two-part test, not two separate tests.
And so I know that there's, especially when we're doing this ourselves, questions about when to test. If somebody feels like, for whatever reason, they either have symptoms, they've been exposed, they want to take a test, when is the best time to do that at home?
Yeah, thank you for asking, because people often want to test right away. And it's going to take a while for the virus to build up in your system if you do catch COVID to where it's detectable. So 5 days after your exposure is what's recommended.
Okay, I want to talk about the numbers that we've been seeing. And again, correct me if I'm wrong in this, but we've been seeing the number of cases go down, but we've been seeing the number of deaths go up. What is the reason for that?
This happens every surge, and it is because it takes a while to get from where you catch the infection and then you get tested and then you feel sick enough to go to the hospital and then things don't turn out so well in the hospital. So there's a lag, and then the hospital ends up having to report to us. So you can usually expect a 2 to 3 week lag.
Okay, so I know that as medical director, you understand a lot more about the way this disease behaves, pandemics in general, than the rest of us, the general population. So with where we are right now in this surge at this point in the pandemic, what is your overall message to the rest of San Antonio in terms of trying to stay safe and get through this?
Yeah, this is a time when a lot of us have some hope. But there's a lot of uncertainty too. And that's because we are now at a point where we could be living with the virus. What does that mean? It means we're going to pay more attention to hospitalizations than cases. It means that it's possible that we might not have more waves, or it's possible that we'll have more waves, but they won't be as disruptive. It doesn't mean that COVID will be completely harmless, because other infections that are endemic, like flu or rabies is endemic, that can be very harmful to individuals, but maybe not as disruptive to all of society. But that depends on more of us getting vaccinated. This is still an opportunity for more of us locally and globally to get vaccinated, because every person that gets infected is an opportunity for another variant. And that's the big unknown right now.
Dr. Junda Woo, the medical director of Metro Health, thank you so much for your time and the information you gave us today.
Thank you.
Take care. We'll be right back.